really was just the limiting factor was results, because people were trying products, but they would think that if I just take a supplement for a couple of days, that it'll all of a sudden produce this magical recovery from my years of dietary neglect. Or the biggest issue was the absorption rates were just so low with the products I did have that it just wasn't creating any profound impact, and patients weren't feeling like they were winning by taking them. They thought they were taking them like we used to, because you're supposed to, but not because you really felt the difference, because you really saw your health changing. And so the motivation wouldn't be there to retain the patient and keep them managing their health ongoing, because they would say, well, I don't know that this decision and the money that I'm spending is really giving me any quality of life improvement that justifies my commitment to this. So it was always it was more of a behavioral thing, rather than anything else. Trying to get people to choose health is not easy. And it's also not logical, by the way. If people think choosing health is logical, you can give them the right recommendations of losing weight, eating healthy, exercising, not smoking, not drinking as much, and they don't do it. But then they have their first heart attack, give them the same exact recommendations, and they'll do it. The logic of the recommendations didn't change, but the emotional status of the person did. They were more receptive, more willing to take control of their life. And you got to find that emotional time to press the button on a patient and say, now let's go. You're ready.
I would assume both of you would say, and I shouldn't assume, I'll let you both speak to it, that this particular graphic here